Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in forensic medicine. Today in this video, we'll continue with organic latent poisons. In that, we'll discuss about ergot, which is a form of fungus which grows on the cereals. Characteristics of ergot. Ergot is a dried sclerotinim of the fungus Claviceps purpurea. So sclerotinim is nothing but a compact hardened mass of a fungal mycelium. So that grows on the cereals like rye, barley, wheat, and oats. So we can see in this image, this is the part sclerotinum of Claviceps purpurea, which contains the ergot. It gradually replaces the green, forming a curved dark purple or black compact mass. So it starts growing on wheat, like example wheat. It starts growing on the wheat and forms a hardened sclerotinum, makes a black compact mass, which is about 0.9 to 1 centimeter long, half a centimeter in thick, with lengthwise ridges and has peculiar odor and disagreeable taste. So this is grows on the any part of any form of cereal like rye, barley, wheat, and it replaces the grain. So this again image of the ergot. This is the Claviceps purpurea which is grown on the wheat. And when the wheat is harvested, it is mixed with the normal cereal. So these are the wheat grains, and this is the ergot, which is a fungus of Claviceps purpurea, which is grown on the cereals, which will be mixed with the normal harvest, and because of that it gets contaminated, and if the person consumes, becomes poisonous, become poisoned. Coming to active principles, it contains about 30 alkaloids, among them ergotoxin, ergotamine, and ergometry are the important ones, and they are all ecbolics. So ecbolics are nothing but chemicals which cause uterine contraction. So for these purposes, it is also used as a for abortion, criminal abortion. It is also used. So these are ecbolics which causes uterine contraction, and ergotoxin, ergotamine, and ergometry are the active principles of ergot, Claviceps purpurea. Ergot action. Ergot alkaloids exert the primary effect by stimulating adrenergic receptors both peripheral and centrally. So they usually stimulates the adrenergic receptors and cause stimulates muscle fibers and cause contraction, and other receptors present. Coming to signs and symptoms, in acute cases there is nausea, vomiting, diarrhea and giddiness, tightness in chest, difficulty in breathing, marked muscular weakness and exhaustion. So usually person feels generalized weakness, difficulty in breathing, nausea, vomiting, diarrhea, giddiness, and exhaustion. There may be tingling and numbness in the hands and feet, mainly neurological symptom. Paresthesia, that is abnormal sensations, followed by twitchings and cramps in the muscles. Bleeding from the nose and other mucous membrane is common. After larger doses, the person will start having bleeding from the nose and other mucous surfaces. There will be weak pulse, followed by increasing blood pressure leading to hypertension. Coming to fetal dose is 5 to 10 gram of active principle is fatal, and 1 to several days it requires the person to die after poisoned. Chronic poisoning, when the person consumes a lot chronically. So in chronic poisoning usually occurs when small doses is consumed for longer duration. So small doses is added up in larger doses, leading to chronic poisoning. This is also known as numbness of ergotism. This occurs in this condition, the patient feels tingling and skin. There is vasomotor disturbances in skin, leading to dry gangrene of fingers, toes, ears, and nose. So there is tingling sensation, following, and in skin there is vasomotor disturbance leading to gangrene formation in finger toes. There is sensation of insects creeping under the skin. Neurological disorders like hallucination, ataxia, and convulsions may also occur. So mainly neurological symptoms are present. There is tingling sensation, there is vasomotor disturbance, and also sensation of insect crawling. Coming to treatment, stomach wash to remove the grains. So if the person has consumed, acute poisoning is there, to remove the grains, stomach wash is done. Activated charcoal to remove it absorbs the poison. So that is for them. Silica cataracts is a form of emetics to remove the poison. Then nitroprusside for hypertension and severe ischemic changes. To prevent ischemic changes, nitroprusside is given. Diazepam 0.1 mg per kg IV for slow for convulsions, and vasodilators for nitrates are useful for in cases. So these are all mainly the symptomatic treatment is provided to relieve the person to symptoms. There is no specific antidote is not present, and symptomatic it is given, which can be which is helpful. So first, the poison is tried to remove by giving stomach wash and emetics. Afterwards, the symptomatic treatment is provided. Supportive care is done. Coming to postmortem appearance, there is no characteristic change which is can be appreciated in postmortem change. The internal organs are congested, which is the commonest change. There is degenerative changes of intima of small arterioles and thrombus formation may be seen, but it's not specific. Mainly the organs are congested, which is a sign of asphyxia. The person may die because of asphyxia, and there will be because of decrease in oxygen and leading to congestion of organs. Coming to circumstance of poisoning, mainly the consumption of bread made with contaminated rye is the chief cause of ergotism. So accidental death is the commonest cause. The person accidentally may consume a large dose of ergot mixed with grain, leading to death. Ergot is also commonly used as a abortifacient because it is a form of ecbolic, so it causes uterine contraction, so it is also used as a abortifacient. These are my references. Thank you.